All right, guys, so for today, we're going to go over two different chunks. One's going to be disorders of the eye, and the next is going to be disorders of the ear. There's a few of these that are we're just not going to get through in the wake of the apocalypse that we are currently living through. So if I say to skip a slide, don't worry about it. I promise I'm not going to test you on anything that I tell you to skip. So we're going to start first with disorders of the eye. Cataract. So the first one we're going to talk about is cataract. You've probably heard of cataract. Dogs get these too. So usually it's only in the elderly. Very common, 70 years and older. Every now and then, you know, people even in their 60s or so. So the main thing is it causes blurred vision, but it is painless. So they don't feel any pain. Their vision just gets crappy. And I'll show you what it looks like. Ugh. Okay, so this is patient's right eye is the cataract. So remember, first of all, this man is not on drugs. We gave him some sort of eye drops to dilate his pupils so that we could see really clearly. So this is a super dilated pupil. Usually if you see this, it means they're on some sort of drug. But remember that the pupil is just a hole. And so usually we're seeing through this black hole down deep into the soul because the lens is clear. So usually you see right through it. It doesn't show up behind the pupil. But here, the lens is cloudy. The lens is whitish. And so instead of seeing through the lens because it's just invisible and transparent, we're seeing the lens itself. So usually in order to fix this, we're just going to do surgery. We're going to take out this lens and put in an artificial lens. And that's done outpatient, meaning they don't have to stay in the hospital or anything. You can just go to your eye doctor and have it done and go home the same day. Next is color blindness. Color blindness is so fascinating to me. It is a problem with seeing colors. Now, a lot of people hear the word colorblind and they think these people can't see color whatsoever, but that's not it. One out of a gajillion is that it. Usually it's certain colors look like other colors to them. So as you can guess, it is a cone problem. So remember on the retina, you have rods and cones. Rods help you see in low light, so that's more like shades of gray. And remember, cones are bright light, which is our ability to see color. This is a sex-linked condition. It is carried on the X chromosome. So remember that girls are XX. So usually they will get a good X, and then possibly if one of their parents has color blindness, a crappy X. But the good X will cover it up. So girls are frequently carriers, but very, very rarely are they actually colorblind because both of their parents had to give them a colorblind X to have it. We see it in males, however, because dad gives a Y and mom was a carrier and gave a crappy X. And so then they don't have a good X to cover it up. So then they end up being colorblind. This is Ishihara test. This is the colorblind test. There's a lot of them, but this is one of them. There's a lot of these little circles. They're all Ishihara. So if you can see the 45 here, you are not, this is probably a red-green colorblind. Like I said, there's different colors that gets mixed up. And that's why we have to do different circles in the different colors because sometimes they won't have any problems with, say, this one, but say they are maybe blue-yellow colorblind. And so then they can't see the numbers inside of those. Here's another one. This one's pretty crappy. You probably could see that 62 even if there wasn't even if the colors were blind to you. This is a really good one. One time I diagnosed a girl in my class with color blindness. She freaked out a little because she could not see this. So you see the box and then you see the circle. She could see the circle just fine because that's not the type of colorblind she was. She had no idea that this was a different color. Her whole life, she had no idea that she saw browns as green. All right, next one is pink eye. I'm just going to go ahead and put this picture up here because I want to gross you out. Bam! All right, so remember your conjunctiva was that little membrane that covers your eye, and it's also like your eye pocket, not the hole in the skull, not the orbital socket, but the pocket of flesh is that little membrane where you put eye drops into. So when that membrane gets itis, inflamed, it gets all red, and then we call it pink eye. So this is inflammation of that conjunctival membrane. So the inflammation can be for a ton of different reasons. So if you look down here, it can be bacterial, it can be viral, or if you just have allergies and get red eyes in the spring, that's still conjunctivitis. It comes with redness, which is where we get the pink for pink eye. It's painful, it's swollen, and a lot of times you get this super bad mucus discharge. We can tell viral from bacterial because one presents with more mucus versus the other. But if it's bacterial, we're going to give you antibiotic drops. This is incredibly contagious. It is so contagious that, say, your left eye can give it to your right eye. So this is one of the things that you're not allowed to come to school with if you have, because it's so contagious. Good hand washing is important for this. You don't want to touch your eye and then touch your other eye because you'll give it to the other eye. Next comes a detached retina. A detached retina, all I want you to know is that the retina detaches from the back of the eyeball. You can see it kind of happening here. And so then some of that jelly gets behind and makes it worse and worse and worse and just keep detaching. All I want you to know about this is that it happens. Sometimes it's injury and sometimes it's diabetes. But in order to fix it, we inject an air bubble into your eyeball, which is super cool. But air bubbles always float up, right? And as you can see, the problem isn't at the top here, it's at the back. So for this person, when we inject this air bubble into their eyeball, we'd have to have their eyeball looking down this way, and it would have to stay there for like 24 hours because then the air bubble would float up and push this retina to the back wall and let it heal there. I always thought this sounded really sci-fi and was probably nothing that I'd ever come into contact with. And then working in nursing, I've taken care of 3 or 4 different patients that were like, I had an eyeball surgery where I had to lay on my belly for a day. And I'm like, oh, well, crap, that's cool. That was probably a detached retina and you had to lay there for a day while that air bubble held the retina to the back choroid, that vascular layer, so it could heal. Super neat. Diabetic retinopathy, all I want you to know is that uncontrolled diabetes, remember we talked about uncontrolled diabetes causes blood vessel problems. And so it can happen like in your feet, and your feet don't get enough blood. And so then you get that black toe and we have to chop your toe off. But it can also affect the blood vessels in the back of your eye. So when it affects those tiny little blood vessels in the choroid that feed the retina, sometimes people with uncontrolled diabetes can go blind. And we call that diabetic retinopathy. It's actually pretty common, one of the most common reasons for blindness in America. You got the glaucoma. Okay, so glaucoma is where? So remember I said there's 2 types of fluid. There's a aqueous humor up here in the front of the eyeball that's legit water and like made and drains off and made and drains off. And then there's this jelly fluid in the back called vitreous humor. So glaucoma is actually really complicated. And there's different types of it. You can have like open angle and closed angle, all these different types. All I want you to know about glaucoma is that in glaucoma, there's too much fluid in the front here. So I don't care if it's that you're making too much or you're making the right amount, but it's not draining off right. Too much fluid builds up here. And so eventually, because there's too much fluid, it starts pushing on the lens, which pushes on the vitreous humor, which pushes on the retina and the optic disc here, that blind spot at the back, and it can actually detach your optic nerve. This is painful. A lot of times, sometimes it comes on quickly, sometimes it takes a long time. A lot of people have the question because they've seen it in movies or heard on TV that you can smoke weed to treat glaucoma. It actually does treat the pain for glaucoma. However, you would have to do entirely too much marijuana because it only helps for a little bit. So it's not a long-term treatment for it. Macular degeneration, all I want you to know is the macula was the point on your eye where you can see the best. It was your straight on vision. So people with macular degeneration, this right here was the macula, and you can see all these little yellow deposits there. We don't really understand what's going on anyways, so don't get too caught up in it. But when that clear central vision starts to break down, we call it macular degeneration, and that's how it presents. And that creepy, that's like something out of a horror movie. So remember, the macula is when we look straight ahead. So a lot of people will notice this when they're looking straight ahead at a person's face, and so their face is blurry. We test for it by making you look at a grid. If you've ever seen these grids in the eye doctor's office, this grid in a healthy person would be normal. But you see this, it's okay, you don't have macular degeneration, the spot really is here. This is what someone with macular degeneration sees. And that's all I want you to know about macular degeneration. All right, so let's talk about vision problems. If you have ever heard of someone being nearsighted, raise your hand. You silly, why'd you raise your hand? I can't see you. Okay, so nearsighted, and I thought I had this wrong until I went to college. I learned these backwards and I didn't know which was which, nearsighted versus farsighted. So myopia means you are nearsighted, which means you can see things that are near to you. Your near sight is good. What you can't see is stuff super far away. So this is what a lot of people are. This is where, like, okay, so you're reading your textbook, that's cool, you can see that. You can see your phone, you can, read a book. However, when you try to look at the board at the front of the room, when you're at the back, everything's blurry. So this happens because your eyeball is too, we'll call it long. It's too front back big. So all this light comes in, and remember the job of the lens here is to focus it. So your lens is doing its job and focusing it to make it all hit right here, which is where your retina should be. But your eyeball's all shaped weird, and so your retina's a little bit further back. So by the time the light gets back here to the retina, it's kind of started to scatter again. And so we call that myopia, which is nearsighted. As you grow, as you get bigger and older, and your eyeballs get bigger and older, this gets progressively further and further away until your eyeballs are done growing, which are usually in like your early to mid-20s. So that's why every year it gets a little bit worse, and you need to get a little bit stronger of an eye glass or contact prescription for it. So that's all I want you to know about myopia, that you can see near you. What you cannot see is far away. Now for hyperopia, hyper means like far, excessive, far away. So I always think, going back one, myopia, I can see myself and things are close to myself. What I can't see is far away. Versus hyperopia, I can see things that are hyper far away. So excessively super far away. So these people have no problem seeing the board or someone all the way across the room. But when they look down to read, the words right in front of them on their phone or in their book are blurry. So hyperopia, far-sighted, is good. What you cannot see is close to you. So this is the opposite problem. So with these people, instead of the eyeball being like back front too big, it's top bottom too big. So their eyeballs are too tall, but not far enough back. So the lens is doing its job and focusing everything where the retina should be, but the retina is way up here. And so it's not quite focused by the time it gets there. Same thing, keeps getting worse until your mid-20s, and then your eyeball stops changing shape. And so you can level out at about that point. Now, astigmatisms. Those of us who have astigmatisms are lucky enough to have a far more complicated problem. So this isn't just a shape of the eyeball, like the whole globe, the whole ball itself. This is where either the cornea, that clear window of the eye, which is right here, or the lens itself, which is focusing the eyeball, is all bumped and weird and mountain shaped. So it scatters the light. So here you have a normal lens and a normal cornea. And so the light's coming in and getting focused exactly where it's supposed to, back here on the macula of the retina. Here you have, in this astigmatism, it's the cornea that's misshaped. And that's a lot of times what it is. And so it comes in and it scatters everywhere because it's pew, 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 bouncing off of all those mountain ranges. So astigmatisms do not get worse as you get older, at least not as bad as hyperopia and myopia do. This is just crappy from day one. Presbyopia. So presby means old. So you probably know someone who's old and has to wear like reading glasses. That's presbyopia. So presbyopia is basically the same thing as hyperopia, where they can't see close up. They have to put on glasses to read, but it's just for a different reason. So in hyperopia, it was the shape of your eyeball, and that happens from birth, right? But with presbyopia, even though it's the same outcome, it's not the shape of your eyeball. It's because your lens got hard. As you got older, things don't stretch and move like they used to, and that includes the lens. So usually around age 40 or over, these people end up with reading problems. They need reading glasses to see close up. And again, it's not a shape of the eyeball thing. It's that their lens won't bend and focus light like it used to. So a lot of times they get what we call readers, just reading glasses. If they have problems seeing far away that they've had all their life, but now they also have problems seeing close up, we do something called bifocal glasses. So when you're looking straight out, you would have your distance prescription to help you with your myopia where you can't see far away. And now, usually when we're reading, we look down a little bit to read. So down here in the glass, they put the presbyopia prescription to help them see when they're looking down. Bifocals used to be super obvious that there were two different prescriptions. Now they've gotten really cool and you can't really tell that there's two different prescriptions here. This was first thought of by Benjamin Franklin way back in the day. So this is a Snellen chart. So I want to talk to you about what it means to be 20/20. So this number is, this first number is always 20. It never changes, but the second number can change. It means I can see from 20 feet away. It's always 20. What the average person can see from, and then comes this number. So if you're 20/20, it means that you have normal vision. You can see from 20 feet away what most people can see from 20 feet away. Before I had LASIK eye surgery, my left eye was 2300. Let that sink in. So I had to be 20 feet away. I had to be super close to something that other people could see from 300 feet away. I knew that was bad, and then I put it into correct terms and thought about it, and I thought, oh Lord, that's almost a football field. So I had to be 20 feet away from something to see what most people could see from a football field away. I also want to talk to you about Perla. So Perla is what we say about pupils. So it means the pupils are equal, both of them are the same size, round, they always should be, and they react to light. We're not going to really talk about accommodate because it's a little fancier, but pupils are equal, round, and they react to light, meaning when I shine a flashlight in your eyeballs, the pupils constrict. And then when I take that light away, the pupils dilate, they get big again. So again, this is called a Snellen chart, and it's how we test vision. If you want to pause at this point, this is where your worksheet, I think, is based on just eyeball things. I'm not sure, though. So we're going to go on to ears, which is much, much quicker, I promise. So disorders of the ear, first of all, this is called an otoscope, O-T-O, otoscope, and it looks into ears. O-T-O means ear. There's also something, an ear, nose, and throat doctor, and that's an otolaryngologist. Otolaryngologist. Don't worry about it. Moving on. Ew, look at that. Okay. So that's external, meaning outer. And remember, oto means ear. So oto and then itis. So an outer ear infection. A lot of times we call this swimmer's ear. Raise your hand if you've ever had swimmer's ear. Anybody just raise your hand again? I get swimmer's ear a lot. My brother gets it all the time. Sometimes just the shape of your ear canal, the part where you could put a Q-tip but never should, is just shaped in such a way that you're really likely to get external otitis or swimmer's ear. So these are generally bacterial infections of the outer ear. And so what you see here is a super angry outer ear. This is swimmer's ear. And sometimes it's from abrasions, which means scrapes, which is why we shouldn't use Q-tips. Oftentimes it's from dirty water getting in there. So rarely do people get it from like showering. Usually it's you swam in dirty water like Lake Norman or the ocean, and some of that water got trapped down in here and it got infected. So it's itchy, it's red, it's painful. Usually we have to do antibiotic ear drops. There are some other, like you can get over-the-counter drops that have like a lot of, I forget if it's like peroxide or something in it that helps dry up the fluid in there, but they're pretty effective as well. Your best bet is to prevent it. So keep your ears dry and don't put things in your ears. Ears are self-cleaning. You don't need to stick anything down in there. This is a middle ear infection, which is what we call just an ear infection. So otitis, ear inflammation, and media, meaning middle. So remember, the middle part of the ear is where those three tiny bones are, and it's usually an air-filled environment. So when bacteria or virus gets in there, and a lot of times it got in there going up that eustachian tube that connects it to your throat. If bacteria or virus gets in there, it gets all inflamed, and your body's reaction is to secrete fluid, because remember, when anything gets inflamed, that plasma gets to leak out and it gets all swollen and nasty. And so fluid gets in that area that should only be filled with air. So I'm going to show you what it looks like. So if you notice here, this tiny little cone of light is what we call it, should always be at this exact angle. When there's pressure built up behind this, which is the eardrum, and this is that first ossicle, the malleus that you're seeing, when pressure builds up in this air-filled area behind the tympanic membrane, the eardrum, notice how this cone of light is pointing straight to the right, even maybe up a little bit. That is an ear infection. And if you couldn't tell based on that cone of light, ew, look at all this nasty infected fluid. Ugh, that's definitely a middle ear infection, which we call otitis media. This is super common in kids just because of the size and the shape of their middle ear. It presents with pain, fever. Sometimes you'll get fluid draining. And in little kids who don't have like words yet, they tug at their ear. It's the most pitiful thing to see. They'll just be yanking at it because it hurts and they don't understand it. And so they're trying to it's almost like they're trying to rub it because it hurts. We treat these with, We treat these with antibiotics if it's bacterial, although I'll say that a lot of studies suggest that they don't really do any good, that your body's going to heal it on its own. So a lot of times we'll give you a few days to see if it'll get better, and we only treat it if it's not getting better after that. There is something called a myringotomy, which is this. So that's tubes in your ears. So raise your hand if you've ever had tubes in your ears. I can't see you. So this is the tube. Sometimes these will fall out on their own and the eardrum will just heal, and sometimes we have to surgically go in and take them out. So basically, if any fluid starts to build up back here behind this eardrum, behind the tympanic membrane, it'll just drain right out before it can cause pressure and cause an issue. We put those in when kids have super, super frequent severe ear infections as a child. Otosclerosis. Oto means ear and sclerosis means hardening or drying, but here it's hardening up. Otosclerosis is where the stapes gets hard and won't vibrate anymore. So I'm talking, it's vibrating air, it kicks the tympanic membrane here, the eardrum, it vibrates, it kicks the malleus, malleus kicks the incus, incus kicks the stapes, stapes is like, not today, Satan, because the stapes is too hard, it won't move anymore. So the stapes stops the vibration. So it never gets to the magical little hairs here in the cochlea. So they don't shake, so they don't send the message to your brain, so you don't hear anything. So it causes hearing loss. So we treat this by, and a lot of times it's only on one side, but sometimes it's on both. We go in and we cut this sucker out and we put a fake one in that will still vibrate. Tinnitus. Oh, guys, I wish you could see me for me to explain what tinnitus is. So tinnitus is basically when it's quiet, and instead of it being quiet, you hear it going, ee! Oh my God, it's ringing in your ears. I hate this. Every time I go to a concert, I have this. In fact, if you look at my Instagram, all of my concert videos are tagged #tinnitus because I go home and my ears ring for hours and hours. This is a symptom, really. It's not really a disease, even though there is a test question that says, what disorder is ringing in the ears? It's tinnitus. They're just stupid. It's a symptom, though. Usually it's harmless. Generally, it's just because you were at a concert. You heard something really loud. Remember those magical unicorn cells in the cochlea? Well, when I'm talking, they're doing this back and forth, right? It's like this subtle, gentle movement because my voice is so calming. But when you go to like a concert, they're doing this. They're freaking out. And so afterwards, instead of like this nice little happy cell, it's like this broken, pitiful, bent scarecrow looking thing. And the bend in them, instead of being nice and straight, because they're bent and damaged, your brain picks up on that bend as a noise. And it's like, oh, I must still be hearing something. Eventually, I mean, you go to sleep and you wake up and it's fine. So they will heal themselves. A couple other things can cause it. Otosclerosis, that thing we just learned about, can cause it. And also Meniere's is quick to cause it. We're going to talk about Meniere's on the next slide. So Meniere's is idiopathic. What's that mean? That's right. It means we have no idea what causes it. We do know what happens, but we don't know why it happens. So remember I said the cochlea, I'll show you here a healthy one. The cochlea and the semicircular canals are fluid filled always. Well, when there's too much fluid there, for some reason, you end up having Meniere's. And Meniere's is vertigo. Vertigo is a severe, severe dizziness. Like, I've seen people with vertigo laying on the ground, holding on to the ground because they think the world is going to fling them off. It is super, super bad dizziness. Either they feel like they are staying still and the world is spinning, or they feel like they are spinning. And it's real, real bad. And it's usually for like 30 minutes or so at a time, sometimes for hours. And that causes nausea and vomiting. This NNV is nausea and vomiting. So vertigo and nausea and vomiting, and that's because the semicircular canals are affected, which is your balance. So your world is spinning because of these. And then it causes hearing loss and tinnitus, and that's because there's too much fluid down here in the cochlea. This is real hard to treat. Most idiopathic things are. We give you anti-nausea medicine so that you'll stop puking everywhere. You're still dizzy, but hopefully you won't puke from it. We put them on salt restriction. Anytime you eat too much salt, you hold on to water. So some of that water is held onto in your inner ear. And if it's real bad, we'll surgically go in and drain some of that fluid off. Let me see. Yeah, so this is the last thing we're going to talk about, and it is hearing loss. So there are two different categories of hearing loss. One of them is conductive. That means the vibrations don't get all the way to the inside. So maybe you have earwax on the inside and that's stopping the vibration. Maybe you have a perforated eardrum like this, which is why we don't use Q-tips, even though I do. Ear infection that's causing the swelling is making it not get in. Foreign body like a cockroach in your ear. Oh, ew, ugh. That will stop the vibrations. Otosclerosis, where let me find this right here, the stapes, remember, is hard and like not today, Satan. That stops the vibrations. Anything that stops the vibration. So an outer ear infection, an outer ear problem or a middle ear problem always cause conductive hearing loss. Now the other category is sensory neural. So sensory neural, it's getting there fine. The vibrations are getting there fine, but something about the cochlea or something about the nerve or brain aren't working. So presbycusis, remember presby means old. So as you get older, you just stop hearing well, and that's an inner ear problem or a nerve problem. Meniere's, remember, where you had too much fluid in here and couldn't hear. Exposure to loud noises, again, where those poor little magical unicorn cells, you've just broken them. Or head injury, something that's actually damaged the temporal lobe or this nerve. We test for hearing loss with this. I have these in class, and if we ever get back, remind me and I'll let y'all play with them. I'll try to link a video somewhere for you as well. It's the Rhyne test. You take these tuning forks, you hold very, very carefully down here at the very bottom, and then you bang these off of the palm of your hand. And so they start vibrating really hard, and then you touch it to a couple different places. So this, you touch it to your mastoid bone, which if you feel behind your ear, it's that bone right behind the ear. And you hear it vibrating. It's super weird and creepy. It sounds almost a little bit like a bee buzzing inside your head. And then once it goes away, you then put these little things right next to your ear, and you should still hear it for a while. This you put right in the middle of your skull, and it's the creepiest feeling ever. Also, these would be my sideburns if I didn't shave them. It's the creepiest feeling ever, and you're supposed to feel / hear it, though, on both sides equally. And if you don't, it's a problem with hearing it in the ear you're not hearing it to. All right, guys, that's it for eye problems and ear problems. Tomorrow we'll pick up on the nose.